Welcome to eMedicore, Patient's Corner series. Today's discussion is about vasectomy. A vasectomy is a common surgical birth control procedure intended to provide a permanent form of sterilization. However, there are other permanent and non-permanent alternatives to vasectomy available. In the United States, about 500,000 vasectomies are done annually. A vasectomy takes only about 30 minutes and can take place in the physician's office. Although a vasectomy is considered a permanent form of sterilization, some vasectomies can be reversed. Additionally, sperm can be aspirated or retrieved long after a vasectomy procedure is done. However, vasectomy reversals or sperm aspirations may be expensive and unsuccessful. This is a diagram of the male pelvis. Sperm travels from the testicle through the vas deferens, past the seminal vesicle, and out the penis. During a vasectomy, the physician will cut or seal off the vas deferens from each testicle, preventing sperm release during ejaculation. With no sperm, a female's egg cannot be fertilized, and therefore no pregnancy will occur. Your testes will continue to make sperm, which is absorbed by the body. A standard, non-complicated vasectomy will not change your orgasm, ejaculation, or erectile function. Also, because sperm comprises only a small portion of the semen, there is no significant change in your ejaculate volume after having a vasectomy. Some of the possible risks of having a vasectomy include, but are not limited to, bleeding and infection, which can occur in about 1 to 2% of men, chronic scrotal pain syndrome, which occurs in about 1 to 2% of men. Few of these men also require additional surgery. The development of a small lump or sperm granuloma may occur, which can be sensitive to touch or pressure and may cause pain. Before the procedure, your doctor may ask you to sign a consent form, not take any blood thinning medications such as aspirin, ibuprofen, or naproxen for at least 1 week prior to the vasectomy, and to take a bath and shower on the day of the vasectomy. Some doctors may ask you to shave the front part of your scrotum. Your doctor may ask you to only eat a light meal prior to the procedure. If the vasectomy will be done under intravenous sedation or general anesthesia, you may be required to not eat for at least 8 hours prior to the procedure. Be sure to bring a jockstrap, athletic supporter, or snug briefs to provide scrotal support after the vasectomy. Arrange for someone to drive you home, as you will not be able to operate heavy machinery. You will also be able to choose to donate sperm to a sperm bank. However, this will need to be arranged ahead of your vasectomy. Immediately before your vasectomy, you will be asked to undress from the waist down. Your scrotal area will be numbed using a local anesthetic. During a no-scalpel vasectomy, a small puncture, as opposed to an incision, will be made in the scrotum. During a scalpel vasectomy, 1 to 2 incisions will be made in the scrotum. This picture shows what the puncture for a no-scalpel vasectomy will look like. This is a diagram of a scalpel vasectomy using 2 incisions. The diagram shows the vas lifted through the 2 incisions. This diagram shows the vas or vas deferens cut at the portion where it was lifted. After the vas has been cut, the ends of the vas deferens are sealed as shown in dark blue with the stitches remaining. This image shows a completed no-scalpel vasectomy using only a small puncture. Notice how the puncture wound is small and no stitches are necessary. After your vasectomy, you should go home and rest. Avoid strenuous or sexual activity for about 1 week. You may experience bruising on the scrotum and a small amount of bleeding. Be sure to wear scrotal support for approximately 3 days. You may also apply an ice pack to relieve any potential discomfort. You may take Tylenol, also known as acetaminophen, or other pain medications prescribed by your doctor. Do not, however, take any blood thinners such as aspirin, ibuprofen, or naproxen. Be sure to check with your physician when you can resume showering or bathing. Normally, this is within 24 to 48 hours. Remember, live sperm may still exist after a vasectomy. Birth control methods should still be used until a post-vasectomy semen analysis, or PVSA test, confirms that no sperm is present in your ejaculate. A vasectomy is not 100% reliable in preventing a pregnancy, even after a PVSA test, indicating that no sperm is present in your ejaculate. In about 1% of cases reported, a repeat vasectomy procedure may be needed.
eMedicore, core medical education. For everyone.
From everywhere.
Forever free.